I thought you were going to do it.
I will.
Excuse me, ma'am. Can I ask you a question?
Oh.
He was going to ask you a question. We had an exam today, and our professor said, how much did GPR bill last year?
How much is GPR?
Yeah.
The options were 300,000, 500,000, 600,000, and 1.6 million. What do you think?
I'm not sure. Yeah, I just from the Florida coming here.
Yeah.
Just for 1 month.
That's it.
Yeah.
No idea. No.
Yeah.
Couldn't guess.
Yeah.
Just any guess.
Thank you.
Okay. Ma'am, can I ask you a question?
Yeah.
So we had an exam today, and one of the questions was, how much did GPR bill last year? 300,000, 500, 900,000, or 1.6 million?
Where?
Oh yeah, it's a very important quiz.
Yep.
Well, you know the answer.
We did.
The answer, yeah.
I have no idea.
No?
I'm gonna say, what was the options again?
300,000, 500,000, 900,000, 1.6 million.
500,000.
Okay.
Pretty close. 1.6.
Oh.
1.6. All right.
Good job, though.
Here's an easy one. You knocked this out of the park. Right down the pipe. What is an indication to use an RPD in an anterior setting zone versus an FPD?
Easy.
I'm just asking. I mean, if you know, you can tell us. You don't have to be shy.
You don't know?
No.
Okay.
All right. If I told you maybe something like ridge loss or something like that, would you agree? Yeah? Okay.
Sounds good.
All right. All right.
Can you use an implant anywhere?
No?
Good
She's
answer.
good.
She's really good. Okay. Well,
Hey man, I had a question. When we're developing treatment plans for class, what's something we shouldn't take into account? Should we talk about price, the patient's health, or the patient's free time? Should we include all that?
No, the price is something that shouldn't be like.
We shouldn't talk about the price.
No, but the price should be the last thing.
Okay, awesome. I got one more question. It's about dent and ferrule, okay? So we just did endo on a tooth, and how much ferrule do we need? 1, 2, or 3 millimeters? 2. That's good. Thank you, sir. You're welcome. This guy's good.
go. Ask her a question.
Okay.
Yes, God,
How much did GPR bill last year? 300,000, 500,000.
This is a person that should know too.
1.6 million.
That's right.
That's right.
What amount of dent and ferrule should you look for on an endodontic?
5 millimeters.
5 millimeters. Even the homeless guy got that one.
Okay. Well, please
sounds
do.
good. Okay.
Seriously, the question.
Yeah, so Dr. Shrout said that a person off the street can pass this test. So we're interviewing everybody we run.
Okay. All right.
Yeah, I just wanted to ask you a couple of questions real quick. Is a full gold crown on your tooth part of the preparatory phase? True or false?
A full gold crown.
Full gold crown, like a gold tooth. Is that something you do at the start? Finish, yeah. Good answer. What phase treatment? Phase 1, 2, or 3 is a denture?
Phase 3, because after that, you don't have
the last thing you do, right?
That's right.
Yeah. So if you're going to pull a tooth, is that phase 1, 2, or 3?
2.
Close. That's a pretty good answer. What's one more good one?
Would you think that a ridge loss in the anterior aesthetic zone would be an indicator for an FPD and RPD?
Say that again.
Anterior
ridge
ridge.
or a denture?
Okay, say the
So
question?
you lost some bone up front.
Okay.
Would you get a bridge or a denture up front?
A bridge.
Okay, good. That's good. Thank you.
Pretty good, thanks. We're looking for participants.
Hey, I'll help you any way I can.
All right, we're just going to ask a couple
What you want me to
questions.
stand on my head, walk on my head?
We're just going to ask a couple questions. Our professor told us our exam this morning was going to be easy enough that anyone off the street could pass it.
Okay.
So we're going to ask a couple questions and see if you're all right. Would a gold crown be part of your preparatory dental treatment?
No.
No. Good answer. When would you phase endodontic treatment, like a root canal? Phase 1, 2, or 3?
I'd go phase 3.
Phase 3. How about a denture?
Phase 3.
Phase 3. How about extractions, pulling teeth?
Phase 2.
Phase 2. How about this? How much money did the GPR program bill last year? I'll give you choices. 300,000, 500,000, 900,000, 1.6 million. Bill.
Question. Bill.
Yeah.
1.6 million.
1.6. Very good. Final question. We'll get out of your way. If you have a tooth that needs a root canal and has severe bone loss around it with calculus and plaque, and bacterial infection. Do you do the root canal first, or do you do the bone loss treatment first?
Bone loss.
Bone loss and then root canal. All right. Questionnaire for a class. Can we do a video questionnaire with y'all? All right. So our professor said anybody could pass the exam we took this morning. Anybody off the street. And you're a street person, so we're going to ask you. All right? You have to get 2 out of 3 to pass. All right? How much money did the GPR program bill last year? 300,000, 500,000, 900,000, or 1.6 million?
300,000.
If you need a ferrule that is apical to a restoration on a tooth that you're going to crown, do you need 1 millimeter, 2 millimeters, 3 millimeters, or no ferrule at all?
2 millimeters.
Very good.
Very good.
All right. Last question. If you have anterior ridge loss of the bone and gum in the front of your mouth, would you go with a bridge or a partial denture?
A bridge.
Well, you got 1 out of 3.